Welcome back to part 2 of chapter 25. We left off, we were talking about this slide, patient education for drug use for coughs. And we're now down at bullet 3. So antitussives should be taken only in specified doses. Avoid smoking, dust, and other irritants to decrease throat irritation. Chew gum or drink water, or you can suck on sugarless hard candy to diminish coughing. So there are two major groups for antitussives, and they are opioid and non-opioid. And I have a question for you for a virtual ticket. If you want to email me this answer, the question is, what is the major ingredients in non-opioid cough syrup? What is the major ingredients in non-opioid cough syrup? If you want to shoot me an email, I'll give you a virtual ticket for that. And so look that up and make sure you have that in your notes. Antitussives should also be used when a cough is non-productive, when it interrupts sleep or daily activities, or if the cough is excessive. Codeine preparations are the most effective cough suppressants. Only small doses are needed, and a few Schedule 5 preparations are available over the counter. Many antitussives are Schedule 3 drugs, and I'm not going to read that next part, but that might give you a little bit of a hint on your email. So some common over-the-counter antitussives are Robitussin or Benadryl, and preparations containing codeine cause drowsiness, therefore they should be taken with care. This week you will notice this as an assignment in Canvas. This is a class activity. I'm going to ask you to identify the symptoms treated by each of the following cough preparations: the basic suppressant, expectorant, and then the combination of suppressant and expectorant, decongestant, and then a cough preparation that has suppressant, decongestant, and expectorant. So be looking for that in Canvas as a class activity. Let's talk about drugs for acute conditions of the lower respiratory system. Mucokinetic agents promote secretion removal. So expectorants render cough more productive by stimulating respiratory tract secretions and decreasing the viscosity of the mucus. Mucolytics react with mucus and make it more watery. Examples of this might be the Robitussin, Duratus, also the Pulmozyme for cystic fibrosis. Mucokinetic agents work on the respiratory tract passages by making the mucus watery so that the cough is productive, therefore making the sputum easier to expectorate. And the expectorants work on the respiratory tract passages by making a cough more productive, by stimulating the respiratory tract secretions and decreasing the viscosity of mucus. So remember the differences between the mucokinetics and the expectorants. Let's talk a little bit about medications for asthma. So most medications for asthma are administered by inhalation because the medication is delivered directly to the site where it's needed. Have you ever had to take any inhalers? How did they make you feel? And did you get relief from it? Typically with inhalers, we see an increased heart rate, sometimes some nervousness. And it's important to note that glucocorticoids are the most effective anti-asthma medications. They suppress the inflammation. Nebulizers or dry powdered inhalers are another way that we can treat chronic pulmonary diseases. When the medication is administered via the MDI, it requires 2 puffs and allow 1 full minute to elapse between puffs. The patient can gargle after use to prevent throat irritation and stomatitis. Patient education and demonstration are very important here because correct administration is difficult and correct administration is key to using the medication correctly. So we have the MDIs, the nebulizers, and the dry powders inhalers, and they are different. So when we do a nebulizer treatment, this is a little bit different where the medication actually goes into the nebulizer machine. It can be administered via the mask or also with our pediatric patients, we would use a mask. As they got older, you can use the mouthpiece and have them inhale from there. So they are different. And then a dry powder uses the dry powder with the inhaler. So here's the mouthpiece I was talking about with the nebulizer. This patient is a pediatric patient. I didn't realize that I had an example of the pediatric patient here. And when they are younger, if we administer with the mask, we can guarantee that they're going to actually be able to take the breaths correctly. As they get older, they're able to follow the instructions here with the mouthpiece in and breathing in and out. So here's a list of common bronchodilators, and you can take a look at this. Some of these are familiar from other chapters. Go ahead and take note of that, and this might be something you come back to look at when you have your assignment for your top 5 medications. Okay, common bronchodilators, xanthan derivatives. So here we're talking about patients with heart failure, heart disease, hypothyroidism, convulsive disorders, and acute pulmonary edema cannot use these derivatives. These derivatives relax smooth muscles of the bronchial tree, stimulate cardiac muscles, the central nervous system. Side effects are nausea, anxiety, restlessness, gastric upset, GERD, headache, insomnia, tachycardia, and nervousness. Some examples of these would be theophylline, alixiphyllin. Here's a list of common glucocorticoids used in treating asthma. It's important to note that prophylactic administration in chronic asthma is preferably given by inhalation, while oral use is effective in the treatment of severe asthma. Common adverse effects include oropharyngeal candidiasis, and inhaled glucocorticoids are dispensed by MDI and DPI. Here, Flovent is a good example of a commonly used glucocorticoid. You may have heard of it, and when you're making your list, I would include that. So prophylactic medications for asthma, Crumulin and Indocromel are used to prevent asthma attacks, but they're not useful for ongoing attacks. So Crumulin suppresses the inflammation but does not dilate the bronchial tree. Rather, it inhibits the release of histamines, acting as an anti-allergenic. The most common side effects are wheezing and coughing on administration, and Indocromel, also an anti-inflammatory and anti-allergic, has an unpleasant taste on administration. Let me go back. A common one here, we see Zyflo, also the nasal crom, Singulair. You've probably heard of several of those. Drugs used to treat asthma. So the Crumulin is for the prophylaxis of asthma and should be administered 30 minutes before exercise. The beta-2 agonists are taken for long-acting therapy and should be taken on a regular schedule. Many beta-2 agonists are delivered by the NDI, DPI, and the nebulizers. Alternate day dosing is achieved by taking one dose every other day at the same hour, and that's important that you take it at the same hour. If symptoms of asthma become worse, the patient should not change doses or self-medicate without consulting a doctor. Asthma can be life-threatening. A patient with thick secretions from the lungs should drink 6 to 8 glasses of water per day. And we know from our other class that it's recommended to have 8 glasses a day, or the other recommendation that we see often is half your body weight. Patients should avoid smoking, and this is a very important and difficult patient education with asthma. So coffee, chocolate, and charbroiled food should be avoided if they're taking any xanthan preparations, and that's another part of our patient education. Asthma and COPD are chronic inflammatory diseases that cause inflammation of airways, bronchial secretions, and bronchospasms, and are treated with anti-inflammatory agents and bronchodilators. Inhaled beta-2 agonists are the most effective meds to relieve acute bronchospasms and rarely cause systemic side effects. Inhaled salmeterol has delayed onset and extended duration of action, and it's used to prevent COPD and asthma. The glucocorticoids are for preventative therapy and should be used on a regular short-term schedule. Over-the-counter and prescription meds for respiratory disorders should not be mixed. Inhaled glucocorticoids are relatively safe with oropharyngeal candidiasis and dysphoria being the major side effects. Xanthans have been replaced by newer drugs with fewer side effects. And we talk about this in many of the lectures, we continue to get newer drugs, and they're always looking at lessening side effects and trying to have more direct effect with less side effects. Let's talk about medications to inhibit influenza. So use antiviral medications within 2 days of onset of symptoms to be effective. So if a patient comes in and the onset of their flu symptoms were 4 days ago, then the antiviral medication is not going to be effective for them. Lessen or inhibit signs and symptoms of influenza. So when they take the medication, this medication can lessen or inhibit, but it does not cure. It is not a substitute for the influenza vaccine, and some of the examples might be the Flumidine or the Tamiflu. Safety in patients with COPD has not been established, and a question has arisen concerning safety in coronary patients as well. So if we're looking at a patient with COPD or coronary patients, the physician would be evaluating the safety of these medications that inhibit influenza. Common side effects include headaches, dizziness, nausea, vomiting, and diarrhea. Therefore, many people think if we have these side effects and we are inhibiting influenza, we have to kind of choose which one is better, because a lot of those side effects are things that we're already having with the flu. Again, it's important to remember that you must use the antiviral medications within the first 2 days of onset. Medications for respiratory syncytial virus, also known as RSV infection. This is a major lower respiratory tract infection. We see this mostly in the young, the elderly, and those with cardiac, respiratory, or immune system diseases. There are currently 2 approved drugs. They're Verazole and Synagis. And it's important to note here that the treatment drugs are very expensive. So this is something that you need to be aware of when working with your patient when the doctor prescribes it. And if the patient verbalizes to you their concern about cost, it's important to let the physician know and work with the patient and the physician to find options. Sometimes there are coupon codes or other things to help. And this concludes our Chapter 25 lecture, and I hope you have a great day. Bye-bye.